Professor Griffin, thanks as always. With the UK, there's quite a contrast on so many different levels, including the way that they've rolled out the AstraZeneca vaccine. We see they've still got challenges given the vast amount of community transmission there. But with the AstraZeneca vaccine, do you think there's been, it's worked against us, that it maybe has harmed our rollout, that we've had this anti-AstraZeneca view in parts of the community?
Oh, definitely. I mean, I think there's no one single point that fully explains why we're so far behind where we should be. But I certainly think a lot of negative commentary around the AstraZeneca vaccine has not helped, and in fact has likely harmed the situation here. I mean, we know it's a safe and effective vaccine. We've seen the impact it's had in other countries. And of course, we did change the way we use it here to make sure we were using it as safe as possible. But there remains a large number of people in the group that are still eligible for that vaccine that are hesitant to receive it, based, I think, largely on some confusion over all of that commentary that has been around about that vaccine.
The risk balance obviously shifts as well as community transmission rises. What's the latest ATAGI advice, if you can give us, our audience, clarity on what is the position? What's the advice when it comes to that vaccine right now?
So it remains unchanged. So the AstraZeneca vaccine is preferred for those people 60 and older. And if you're less than that, Pfizer is the preferred vaccine. But AstraZeneca remains an option, and certainly it is a trade-off between risks and benefits, and we'd encourage people to have an individual discussion with their GP or vaccine provider, because in instances where there's perhaps more transmission or you're at higher risk of consequences and maybe access to Pfizer is limited, then it remains a vaccine that may well still be used in that group less than 60.
What's your analysis on where Sydney is at the moment? Does it look like Kerry Chant and her team are getting on top of this?
The difficulty with projecting the future here and knowing where they're up to is obviously there's a big lag behind an increase in restrictions or increased mitigation strategies and actually seeing that impact. The people diagnosed today, for example, were infected before that last increase in restrictions. So we really need to wait a few days to see if they've been effective enough in starting to reduce those numbers. Obviously today was a relatively good day in that we didn't see the same numbers as yesterday, but we know the case numbers do fluctuate day to day. So we really need to watch closely for the next couple of days to see if the trend is a continual downward one. And I would think that we're likely to, but certainly the main thing we need to highlight here is people need to do all the right things to stay away from each other, get tested, and of course keep getting vaccinated if we're to get through this.
Are you encouraged by the recent increase in the vaccination rate? Do you think that these outbreaks, the one silver lining has been that it has punctured some hesitancy among quite a large cohort within the community?
I think it certainly has. I mean, I think a large number of us were saying the virus will come back and we need to be prepared for that, and that's why we need people vaccinated. And with very few cases around, I think people became a little bit comfortable and a bit complacent and thinking that we'd largely addressed this and it wasn't going to keep coming back. But we know it will, and so it has been good to see an increase in vaccination rates. But I think we still have some issues around the communication around AstraZeneca and how it's used. And of course, we don't yet have enough Pfizer for those people that don't want or can't have the AstraZeneca vaccine. So, I think we're on track. I think the supplies of Pfizer should come soon. But, obviously it's great to have people that want to get the vaccine provided. We have the vaccine and ways to give it to them.
What percentage do you think we have to get to? Daniel Andrews spoke about the concern if you get to 75%, there's still 25% who can catch COVID-19, and then that would see our hospitals fill up pretty quickly. What's your sense of where we need to get to ensure it stops community transmission?
Look, I think there's no simple number. The harsh reality is we need as many people vaccinated as possible. Of course, we'd like it 75% or greater, but I think that's going to be a challenging number to achieve. I mean, what we know is that the people that are vaccinated can still get this infection and can still spread it, although they're much less likely to do so. But most importantly, they're almost 100% protected from more severe disease. So if we were able to achieve 70 or perhaps 80% of people vaccinated, that's a very large proportion of the population who are very unlikely to end up in hospital or, more importantly, intensive care. So, I think we need to remain aspirational and certainly hope to achieve greater than 80%. But I think if we can get near that, then we'll obviously be in a much better position than we are now.
And the fact is, we have, as a nation, generally, well, it's not been a nation of anti-vaxxers. You always have a small percentage, but our vaccination rates have been among the best in the world. There's no reason why we shouldn't be aspirational, as you quite rightly point out, Professor Griffin.
Look, that's exactly right. I mean, we are traditionally a nation with very high rates of vaccination. We have excellent healthcare infrastructure and, a great network of GPs who normally do vaccines well, pharmacies that normally do vaccines well, and of course, a great hospital system. So, I think we're really well set up to be one of the best countries in the world. And, perhaps we did too well early on in controlling it, that we got a bit comfortable with that strategy. So, I think we need to be really laser focused now on making sure we realise that all the border restrictions and lockdowns are a great temporising measure to get us to the point where we have enough people vaccinated. It's certainly not a destination kind of strategy, and we really need to focus on getting that vaccine rolled out so we can take some steps back to some normality, perhaps a little bit like what we've just heard about the UK are doing soon.
Professor Paul Griffin, thank you from UQ. We'll talk to you soon.
Pleasure. Thank you.